the future here. Okay, so then you can go back and then rewatch it as you need to. So we're going to go ahead and then jump in here. Let me hit the screen share. Okay. Okay, here we go. Okay, here we go. Bulletproof your lower back. So the mom zebra had just given birth to a baby zebra. And the baby zebra, as it reached the ground, it stood on all four legs and, just kind of opening the eyes, going from the dark place and then all of a sudden to the bright sunshine. And the mom zebra told the little baby zebra, you have to run right now. And the baby zebra is looking around at the new scenery. He's just like enthralled with what he's seeing. It's so new. And the mom says, you have to run right now, baby. And the baby zebra is over there just smelling the air, listening to the sounds and just getting acclimated to the new environment here. And the mom zebra said, we have to run right now. And then the baby zebra said, Mom, can you just wait? I'm just enjoying this environment. And the mom just kept insisting, we need to run right now. And so the baby said, well, why, Mom? Why do we need to run right now? And the mom said, because the lions are coming. If we do not run right now, the lions are going to eat you alive. Now, I know what you're thinking. You say, come on, Dr. B, cute story, but in Vienna, Virginia, Northern Virginia, we don't have any lions running around here. That is correct. No, we do not. But we have the lions of heart disease, cancer, diabetes, obesity, low back pain, sciatica, subluxation, and the list goes on and on. This is why we're doing this workshop here this evening. We're doing this because we want to make sure that those lions do not eat you alive. And it's time to run towards better health. And there's never been a better time than now to be talking about our health and focusing on what we can be doing to strengthen our body and make our body healthier. It is time to run towards unlimited health. And over the next 45 minutes or so, you're going to discover the most effective, the most powerful, the most natural ways to bulletproof your lower back, but beyond bulletproofing your lower back, help bulletproof your health and your wellness so you can strengthen the body from within. So no matter what virus or what other stressor our body encounters day in and day out, our body will be equipped to handle it. So don't allow those lions to eat your health away. It's time to run towards unlimited health. And the first start to that is to get a clear picture on what the health of your spine and nervous system is, because your spine and nervous system is in fact what controls your health, your healing, and your health expression. And that's why we've developed this webinar to teach you some things. So I've been doing these talks for 12 years now. And there is one thing that I've learned. I've seen a pattern. And the people who get the most out of these talks are the ones who engage. And I'm going to use this analogy. And I don't know if you've ever been in the gym like me, but sometimes you see a person A, person B, and person A is over in the corner. They're chatting it up. They're not really doing any of the work. They're just kind of socializing. And then you have person B over on the other side of the gym that's lifting the weight. They're running, they're panting, they're moving, they're sweating, and they're doing the work. So just curious, who do you think is going to get the better results? Person A or person B? Type it up in the chat. Now, I know you all are a very intelligent group that I have here, and I know you chose patient B. So that person B is the one who's doing the work. They're the one who's committed to the results. They're the ones who's going to get the best results. So I encourage you, just give me 45 minutes of your undivided attention this evening, because the one slide, one statement might be the missing link, the piece of the puzzle that you've been looking for that is going to take your health to the next level. And I often find that it's the small details of something that help increase your overall health and well-being. It's not the massive big rocks and boulders that we need to uproot and change. all in one swoop. It is the small little details that'll make the biggest difference. So I want you to be paying attention, taking notes at home. And, I'm curious also, and I want to know from you is that if you have you ever been to a workshop, been to some sort of seminar, and you learned some really great, valuable information, but for some reason life happened and you failed to implement it? I'm raising my hand because I'm right there with you. That's me. That's happened to me before. I don't want to let that happen to you, okay, tonight. So I want you to be taking notes. And if this message moves you, if it resonates with you, at the end, let's make sure that we're doing everything that we can to make sure that you are getting the best results that you've come to this office and what you're seeking in your life. Because what I find is those that are committed the most, that have the clearest goals, are the ones who get the best results possible. Is that cool? All right, awesome. Welcome to Bulletproof your lower back. Let's get going here. I got a lot of ground to cover, and so I'm going to talk fast. So I'm going to ask that you listen fast, please. So I want to encourage you. Many of you have my best-selling Amazon book. If you do not, please let us know. If you are a guest that is viewing here this evening and you would like a copy, I'd be happy to sign a copy and then mail it out to you. So I just need you to send us an email or respond in the chat box. Let us know you want one. We can get the information offline. But I want to encourage you, if you have not picked this up in a while, it's a good idea to take this book and reread it. Take it chapter by chapter, even if you take one chapter a month. Learn this material, own this material, teach this material, because then you can lead from where you live. And I promise you, repetition is the mother of skill. Here's my beautiful family right here, and they're the big why I'm doing this and why I get out of bed every single day. And throughout this presentation, you're going to uncover why I'm so motivated and inspired by them. But a little bit of background about myself. I went to Palmer College of Chiropractic. Dr. Palmer is the first ever chiropractor, and Dr. Palmer, his first patient he adjusted, cured his deafness. So we're going to be talking about that chiropractic doesn't cure low back or sciatic or those pains in the butt. But what chiropractic does is help the nervous system work better and appropriately so your body can function better, heal better, and work better without those aches and pains. Some of my specialties, chiropractic wellness practitioner and certified by the International Chiropractic Pediatrics Association. So some of our techniques and specialties involve family wellness care. My kids have been getting adjusted and their spine checked. And throughout this presentation, you'll understand why the earlier you get your spine and nervous system checked, the better. And we've been ranked top family wellness doctor clinic multiple years in a row. So we're very honored with that. So let's dive into Bulletproof in your lower back here. And let's look at this. Okay, let's unpack it. When I say let's bulletproof the lower back, what do I mean by this? The common presentations that my clients can experience could be low back pain, could be tight muscles. You might feel a loss of range of motion. You're not able to move as well as you once did. You might present with stiffness. There may be leg pain. There might be a pain in the butt, literally. Okay, and there might be sciatic type pain. And we're going to unpack what sciatica is and the true definition of sciatica. There could be numbness, there could be tingling, there could be swelling, there could be burning. A whole restless leg syndrome is a very common one. So let's talk about what we can be doing proactively, because there's got to be a better way to taking care of this once and for all. And the truth of the matter is that low back pain, leg pain, that this is preventable. This is a preventable condition, and it is absolutely correctable. And during our evaluation process in the office, we unpack what's going on, because remember, these are all symptoms of the body. These are not the underlying root cause. We got to get to the root cause. If you want to change the fruit, you got to change the root, as they say. So let me tell you a little bit about my story in lower back. I don't know if you've been like me, but I was in chiropractic school. This is back in like 2002 or so, 2001, and hard to believe it was that long ago. And I remember going on a trip, and I was part of a select group of docs elected to go to Vietnam on a clinic abroad trip. And here I was as a fledgling chiropractor, learning, so excited to go share the gift of chiropractic with the world, and went over to the clinic in Vietnam. And I mean, there are hundreds, thousands of patients each day that a group of 25 students and 5 clinical doctors would see. And it was just very busy, great experience all around. I remember I was like in the first day, and I literally was, you guys see me working on the table, and I literally just bent over to deliver an adjustment. And right in the middle of all this, I felt something like slip, glide, move out of place in my back. And I'm like, man, this cannot be good. So long story short, it was a painful rest of the day. And for the next 3 to 4 days, it got better, but it was very painful. And raise your hand if you've ever had that experience when low back pain hits, it like debilitates you. And thank goodness I was surrounded by a group of amazing doctors that were helping my body heal and get it functioning. So fast forward, I'm into practice, probably my second year. I'm at home and I'm doing the right thing, right? I'm told that make my bed is a good habit every day. And I'm folding some laundry, and I was standing again, bed was a little bit lower, and I went down to grab a pair of socks on the bed. I mean, just grab the sock. I didn't even lift the socks. And then bam, my lower back went out again. I'm like, my goodness, I don't know what I was, late 20s or so, and then my back is going out, and here I am as a chiropractor, and I'm supposed to be serving a lot of people. What is going on here? So I'm very thankful for the education I got, my mentors, my chiropractors, my health practitioners to help lead me on a path to health and wellness that has inspired me to do everything possible to keep my body functioning great. Because look, I am a business owner. We run a very busy practice here in Vienna. We're very blessed with amazing patients. So I need to be showing up healthy and strong for each and every one of you. Okay. The next thing is that I'm married. Okay. And, being married, being in a committed relationship, there's certain responsibilities that I have in this marriage, and I need to be able to perform and be there for my wife. And then we're blessed to have 2 beautiful, healthy children, Kalista and Kyson. Kalista's now 10 and Kyson will be 7 next month. So when we're riding bikes, we're jumping on the trampoline, we're playing basketball or what have you, Dad does not have time to be sidelined. So I'm here to help you, just like I was able to help myself find the solution to bulletproof the lower back. So no matter where you're at in your life, you can live life on your own terms. Everybody cool with that? Sounds like a great thing, right? All right, let's focus on what we can be doing here. We're going to take a deep dive in and explain what's going on here, because I find that my clients that get the best results are more understanding, better understand what is going on, because it's going to impact the day-to-day life choices that they're making. So let's talk about this. Let's unpack it. I brought my friends here. So I got a spine right here, and I want to point out a few things here to you, some anatomy. All right, so pay attention. There's going to be a quiz at the end, okay? Just kidding. All right, but pay attention. All right, so here's your bone, okay? This is the disc right here that is in between the bone. Here, that yellow piece is your nerve that exits out between the nerve hole right here. And right on the back is what's called the spinous process. So if you're watching this with a family member and you're nearby, just reach on the back of their shoulder, go ahead and just touch that bone along the spine. That's the spinous process. If you're watching this by yourself, just simply reach over your shoulder right here and just touch that area right there. And this is what's called the spinous process. So here's the anatomy of the lumbar spine. And the bones are shaped, they're very big and broad compared to the neck bones because they support weight, so on and so forth. So you have the bone, hard, rigid, and then you have the disc, and that disc is the spacer in between the bone. And it acts like a ball bearing to allow those joints to move freely on top of one another. Your spine is meant to move. and it provides an opening and a spacer in between the bone right there, so that that nerve can flow unimpeded to whatever organ, tissue, cell is around that area. And so that's the anatomy here. And the spacer is not the shock absorber. As you take a look on this middle picture, you have specific curvatures in your spine, and you have one curve going this way, then you got a curve going here, and then a curve in your lower back. These curves are there by design because they are, think about the spring system and the shock absorber of your spine. If you lose these curves, then that's going to create a problem. And that's why Dr. Travis and myself do these objective testing when you're in, so we can locate exactly the health of the spine and see where it's not healthy and what we can do to work on fixing it. Normal anatomy is you have 5 vertebrae, L1 to 5, but it's common. We see people with 6 vertebrae. We see sometimes that their sacrum or their tailbone is fusing into their lumbar spine. God blesses us with all different types of anatomy here. So whatever you've been blessed with, we're here to help optimize the function so you can achieve your health and wellness goals here. So here's what happens. I want us to unpack what a herniation is. Sometimes it's a tricky word out there. There's so much misinformation out there, and that we just want to unpack what it means and just simplify it. Herniation really means is that there is soft tissue going into a place where it should not be. That is simple. So think of like a sports hernia. I think you can relate to that. Is then a hernia is some soft tissue going into a place that it shouldn't be. This is a bird's eye view of the disc. And so when we're looking down at the disc here, there's 2 parts of it. You have a very strong annulus fibrosus is the outer, and then on the inside is what's called the nucleus pulposus. Now, you know, I'm going to use this analogy. You probably don't know what a jelly donut is. Okay, I'm certain nobody on this call knows what a jelly donut is. Okay, because you guys are all health fanatics, so I totally get it. But a jelly donut, I'm told, you know, has jelly on the inside, and then there's this outer ring to it. And so if you were to take a jelly donut and you were to squeeze it, and you started to get some of the jelly coming out of the donut right there, that is in fact what's called a disc herniation. You might know it by a disc bulge. There's protruding discs, there's sequestered discs, there's disc fragmentation, there's a lot of terms, but simply you can look right on the center of that disc there, and when you start to see the disc wearing down over time, you can see there's a darker red. It starts to squirt off to the side. Here's the problem. It then exits into the nerve hole. And that's not a good thing, because now you have something that is moving into a space that should not be, and that the nerves in that hole are very sensitive. And it can cause a whole host of problems, which, by the way, it can be present in 60% of the time and you not have any symptoms. See where the problem is? Is that you can have an underlying problem and not know it's even there because you don't feel it. And then you cough, you sneeze, you go pick up a sock off the bed or something like that, and then bam, then it all hits right there. There was an underlying problem that was brewing right there. Then wherever that nerve goes is going to be impacted and it's going to be affected. So if it goes to the back, if it goes to the bowel system, if it goes to the reproductive organs, if it goes to the bladder, if it goes to the stomach, if it goes down the leg, all those organs will be impacted. So let's talk about another definition here about sciatica, because sciatica is, it's a misnomer, because many people come in and like, doc, you got to adjust my sciatic. Okay, well, there's no real adjusting sciatic, because they think that it's like the sacroiliac joint. And very commonly, if you have pain right here on the backside, so here's the front view of the pelvis, here's the side, here's the backside, here's your tailbone where you're sitting most of the time. People say they got pain here. They're like, that's my sciatic. Well, this is your sacroiliac joint. Sciatica is a network of 5 to 7 nerves that come off of your lower spine and your sacral nerves that are approximately about the diameter. That nerve is approximately the diameter of your thumb. Wow, right? I know that's what you're thinking. It's a big cable bundle, and it's made up of multiple nerve roots, and it's the largest nerve in your body. And this is when you have this going on, you know, because this is totally a disruptor of your life. Life is not the same when this is going on. So sciatic nerve irritation causes pain, causes numbness, tingling into the buttocks, legs, feet. It goes all the way down to the heel and into the foot. This is a big deal. We have specific tests that we run to check for sciatica, and we have specific techniques to correct this problem and have great success with it. So there's sciatica. So the point is, it's not a leg problem, it's a back problem, it's a spine problem, it's a disc, and it's a nerve problem. So how do we know what these tests are here? Well, we take x-rays. So you could see healthy normal on the far side here. Healthy normal, we look for multiple things. I want you to follow with me at home here. So we see that there's a curve, there's a healthy curve. Remember what we said, there are curves in the spine that are healthy. In your lower back, you should have a forward curve. It should not be straight, and it should not be too curved like this. There should be a healthy curve here. The next thing, healthy, is good spacers in between the bones, because that allows the nerve a lot of space to breathe. The bone should be nice and square there. And then you see those dark circles on the backside. Those are the nerve holes, big nerve holes to allow the nerves to pass through. If we take a look on that center picture, that is an unhealthy lumbar spine. And this has happened over time. So let's take a look. What do you notice? Type it up in the chat box. Tell me about the curve. Is it a normal curve or an abnormal curve? Is it more than normal? Is it less than normal? Tell me about that yellow circle that you see. Tell me about the disc spacing. Is that normal disc space, less disc space? What about the edges of the bone? Are they nice and smooth, or are they rough and jagged? What you're seeing as the rough and jagged is arthritis. And arth is joint, itis is inflammation of. Then when you see those discs compressed together, it's what's called degenerative disc disease, when you have a multitude of things going on. Now, x-rays are great. They can give us a lot of information. It's just like I described. That tells me that problem, the underlying root problem, has been there at least 15 to 30 years. It's been building up. That's why we do an extensive history to find out what the original cause was and how long it's been, because that's going to dictate how long it's going to take to heal, right? Because it takes time for the body to get in a sick and diseased state. It's going to take time for the body to heal. How about an MRI? Well, another misnomer out there is that discs don't slip. I said I slipped a disc. That's what it felt like, and that's what patients report. But the disc doesn't actually slip and go anywhere. In fact, those fibers are so embedded into the bone that something super traumatic would have to happen to tear those fibers off the bone. It's going to fracture it. So it doesn't slip. There's instability there, and the disc pushes out. So you can see that you can follow the blocks on that MRI. Those are the bones, and you see the white in there. That is the spinal cord and the nerve roots. And that dark material in between the bones are the discs. So you see the top two above, it's a black outline and a whitish color. That's hydrated disc. That's really good. That means there's a lot of nutrients there. But if you go down further, there's dark material. And right where the circle is drawn and the big red arrow, you can see a big piece of the disc is pushed into a place that it shouldn't have gone. And this is what's called a disc herniation, not good. So I don't know if any of you are familiar with I-66 these days. They got a massive project going on that is supposed to widen the lanes to allow for more capacity of traffic to prevent backups, so on and so forth. But for right now, if you take a 4-lane highway going one way and you reduce it down to one lane, what's going to happen? This is exactly the same principle. What happens in the lower back that causes not only the low back pain, causes sciatica, causes those pains in the butt, causes numbness, tingling, causes a weakening, a loss of strength, so on and so forth there. So how does this show up in our office? As we stated before, raise your hand if this is you. If you've had low back pain, have low back pain, muscle tightness, loss of range of motion, you're feeling stiff. If you have leg pain, could be one leg, could be both legs, could be upper leg, lower leg, could be the foot. All these things, if it's the front of the leg, upper leg, back of the leg, side of the leg, tell Dr. Travis and myself specifically what nerve is being impacted during our clinical examination. And then we can go upstream to find out what the root cause is and start working on it. But there could be swelling in the knees, the hips, the feet, burning, numbness, tingling, and then definitely weakness. Let's say you're walking and then all of a sudden your knee gives out, your leg gives out, so on and so forth. That can lead to big problems itself too. Now, how does this all begin and when does it all start? I'm going to have you consider that all the way back at birth, 8 out of 10 children are born with misalignments. But they're not checked for misalignments in a lot of cases. Why? Because they're not symptomatic. And then we grow, and then we start to learn to walk, and we have multiple falls, and then we start sitting in school, and we're playing sports, and we're carrying backpacks. And I know right now with all the COVID crisis and chaos, that looks a little different right now, but follow me on it. And then we use these things now, these electronic devices. Who's guilty of this right here, and who's like stuck on this multiple hours throughout the day? And what about family members at home, stuck on one of these things? And a posture gets affected, and then we got more schooling, and then college, and then we graduate, and then we get a desk job, and now we're sitting 40 plus hours a week, and then it just starts to build and build and build, and those things that the body used to be able to adapt to starting to catch up to us. It's a slow growing underlying problem that, bam, one day we move the wrong way, we cough, we sneeze, we put on a sock or a shoe, and then our back goes out and it disrupts our life. So I want to let you know, we're going to take a bird's eye view on this, and we're going to dive into this and look where the problem is in our quote unquote healthcare system. I want to let you know there's 3 levels of care. And at the first tier level is what's called the treatment of disease. This is the proper diagnosis and treatment of disease and illness. This is a management of symptoms. This is to help people, keep people from dying, okay? This is crisis care. That is the first tier of health. The second tier of health out there is what's called the prevention of disease. And right now, what we have prevention of disease, think about COVID right now. We got the social distancing going on. We got the hand washing, those type of things. That's what's considered the prevention of disease. And although there's a place for treatment of disease and there's a place of prevention of disease, neither of those two do anything to promote health within the individual. Which leads me into the third tier of health, which is called the promotion of health. And that's my conversation tonight with you. Now, I get it. You may be coming in. We may be dealing with an acute crisis here. We're working at pulling you out of there so we can work on then healing up, stabilizing, and correcting the underlying root issue. But once then we get there, it's all about the promotion of health. It's about keeping you healthy. And we're doing our job if you're coming into the office and you're not experiencing any symptoms. That's a great place to be, by the way, because that means that we're staying ahead of the problem, keeping you healthy, keeping you well. More on that later. So what are our options out there today? This is what's called the allopathic option. And what I'm trying to differentiate is between level 1 or tier 1 of health and then tier 3 of health. Allopathic is the treatment and diagnosis and management of disease and symptoms. This is managing symptoms. And you're successful if your symptom goes away. It doesn't address the underlying root cause. But what are allopathic options? Heat, bed rest, drugs, we're going to get into that in just a moment, physical therapy, steroid injections, pain management, surgeries. Are there other alternatives out there? Okay. But what we always say is, when I talk to my client, when I talk to the individual, when I talk to you when you're in the office, here's what I want to know. When you come in, Mrs. Jones, Mr. Smith, what's your goal? What's your objective here? Tell me what the impact this is having on your life. Tell me how it's affecting your health, your body, your function throughout the day. Tell me how it's affecting your being, your overall mood, your attitude, just your energy throughout the day. Tell me this is how this is affecting relationships. If you're married with your spouse, if you have kids, grandchildren, if you're working with your team, your employees, and so on and so forth, your coworkers, how is this showing up? How is this affecting you professionally? Tell me about how this is impacting you all across the board. What are your goals here? What is your objectives? Because based on what your objectives are going to help drive the conversations into what the treatment is. If we're looking just to get out of symptoms, that's one type of conversation. If we're looking to address the root cause, get out of symptoms, fix the underlying problem so that we don't go into a relapse, that's another type of problem. If it's about being as healthy and as strong as we want to be, that's another conversation. So I always say is, if you're looking for a successful outcome, in order to know what that looks like, we have to have a starting point of what are you looking for here. And we got to be looking about what questions asked, be asking better questions. What is the safety, the efficacy of these treatment options, and what are the short-term and then the long-term implications here? So you see, everybody today, this back pain conversation is very relevant to the COVID situation. And I want you to consider this, because everyone today is focused on the strength of the virus. No one's strengthened on the focused on the strength of the host. And this is a real problem, because if you're experiencing pain at some level in your body, it means your inflammatory levels are up. If your inflammatory levels are up, you are immunocompromised. You are not as healthy as you can be. There's more health potential on the other side. So as everybody's talking about COVID and everybody's talking about what can I be doing to strengthen my health and be as smart and intelligent about this, we have to bring this into conversation here. And this is all about bulletproof in your lower back. I get it, all right? Chiropractors are amazing at helping people with lower back, sciatic issues, neck pain, headaches, those type of things. That's like our bread and butter. But on the other side of this is a conversation about increasing our wellness, increasing our health potential, and helping us live our healthiest lives possible. Remember the zebra? Let's run towards our optimal health and wellness and not look back. So how bad is it? How bad is it really out there these days? So I have some stats here that I want to share, because this is more than a low back pain issue. This is a health care crisis issue. 80% of Americans will experience back pain. 80% of Americans. 35% of Americans have low back pain at any given time. Incidence of low back pain is up from 29% to 34% from 1997. So the fact is, this is not getting better on its own. It's getting worse these days. Interesting fact, low back pain is more common in females. 1/3 of females suffer from low back pain. 31% of men report that it affects their work, and only 20% of females say it affects their work. So clearly the females are tougher here, guys. What's up with that? All right. 54% of low back pain sufferers are desk workers. Raise your hand if you're locked to a desk. Sitting is the new smoking. And think about the whole COVID situation. I mean, I'm seeing people more and more talking about we're having posture related issues, not just the parents in the house, but the kids. My goodness. Sitting is the new smoking here. And 50% of women experience back pain when pregnant. This does not have to be. There's needless suffering going on. So I know many of you always tell me you're thinking of someone as I'm going through this webinar here. I want you to take their name and just kind of write it down in a corner, because there may be an opportunity to help them share this message with them and then get them on their track to their health and wellness goals too. The cost is just unreal. So this is not only a health crisis, this is an economic crisis, because the direct cost of low back pain costs the US 50 billion with the B dollars per year, and the indirect cost is 100 billion. And what is the life effect? What's the real story of how this affects people day in and day out? I mean, really, how is this impacting your life? Are you missing out on life? We missing work? We losing money? You're losing productivity? Is it costing your job? Is it affecting your performance there? How about, I hear this all the time. People live around their problem. They don't work towards fixing it. They live around it. So when people come in to see me, they're looking for a solution here so they can live life better, make life better. Because people have, forget about even thinking about goals. I have people that come in and their only goal is, if you could just help me reduce the pain. I'm not even asking you to get rid of it. I'm always taken back by that, because people have stopped doing the things that they love. They've put their dreams up on the shelf because they now live life around the pain. Stop exercising, don't have an active lifestyle. When you're used to having an active lifestyle, that's a downward spiral, okay? Because it not only has physical implications, it has mental and emotional implications. It can make you feel more depressed. It can make you feel lonely. It can make you feel more anxious, can make you feel more irritated and angry. And it changes your personality. And unfortunately today it can lead down that dark path of suicide. And yeah, I don't like going there and talking about it, but it's a fact out there. And we're going to get into some more of that and the big crisis that we have behind the scenes. And the only reason that your eye might have been taken off of this problem is because COVID came out of the blue here, I guess, out of the blue, November, China, I guess it started. And all of a sudden it's taken the US by storm and the world by storm here. But it's real pain, it's real suffering. And the acute pain, we don't deal with it, leads to chronic issues. And it leads to drug use. I mean, I'm talking about over-the-counter drugs. You get the Advils, the Motrins, and when that doesn't work, you get prescribed opioid drugs, heavy-duty narcotics. And then when the pain pills don't work, then we go to the illegal street drugs that are very dangerous. This is our biggest, without question, our biggest health issue right now. I get it with the COVID, and that's a huge issue, but there's a huge epidemic going on with the opioids behind the scenes, and it's ruining communities, and it's ruining families, and it's ruining individual lives. And it's time to step up and step out, take some action, and it starts by leading ourselves. Let's take a look at where we're at right here. This is DEA approved drug production. So when we take a look, you can just see that the numbers are skyrocketing. You might know these things by Percocet and Oxycontin and Vicodin and all the other names out there. But this was never intended to be for chronic pain, just short, episodic, acute pain. But people have become way addicted. It's now the #1 selling drug class in America, and it's over the statin drugs and it's over the anti-anxiety meds. How prevalent is it? We'll take a look at this map with the US right here, and you can see there's a huge belt, and it goes all the way from my home state of Michigan, all the way down to Louisiana, and then spanning from Oklahoma to West Virginia is a really critical area. And if you take the map of obesity and chronic illness and disease and mirror it, you can see that belt of very unhealthy people. And I know I don't have any stats at this moment, but one can only imagine with the social isolation, all the fear, worry, anxiety going on, it can only be fuel to this epidemic and this fire right there. And the truth of the matter is that 40 people die each day from narcotic prescription overdose. And enough prescription painkillers were prescribed in 2010 to medicate every single American adult around the clock for a month. It's just very, very sad. And when you look at the overdose deaths, including opioids, cocaine, and heroin from 99 to 2010, you take a look at these stats, you can see the opioids have just like skyrocketed. On here also that's going up in a big way would be heroin, because heroin acts very similarly. And sometimes when you're not able to get another prescription with the opioids, you turn to the illegal street drugs. And interesting on this, you see the cocaine use is going down because people have become more addicted to these drugs here. And it's all over the news. I'm sure you've seen it. And the only reason why it wouldn't be in the news these days, and I'm still seeing articles here, but is because of what COVID and other things in the news are taking the headlines by storm. But the truth is that we have 3 reasons that we're in this healthcare crisis today. And it's because we have a drug culture. Instead of a healthcare system, people are taught these days that drugs are the first and the best choice for managing health. And at best, the drug may cover up and mask symptoms, sadly. But the scary thing is that all the while you may be feeling better, on the inside, your body is getting worse and getting more unhealthy. And we all know that going down this path, it doesn't end well. And if you're with me on this, there's got to be a better way. There must be a better way. And I have a better way. And let's get into that. So you take a look right here. The truth is, one of the reasons I'm inspired to do these webinars, why I'm inspired to educate, because that's what doctor means, to educate, is half my job's adjusting your spine, the other half is adjusting your mind, helping to educate you. But look, here's the truth. People have never been sicker today. For the first time in the history of man, children born after the year 2000 are not expected to live as long as their parents. I mean, to me, that is just sad. It's heart-wrenching, gut-wrenching. And that's why I'm here. I'm a man on a mission. I have a deep purpose. I know I've been called to be here to help light other candles and help show people a better way. Because I want to lead my family. I want to lead other families to live their best lives possible, because life's too short. Your body is smart. Your body's intelligent. You're intended to be healthy. If you agree with me, raise your hand there. But when we have poor lifestyle choices, it may lead us unknowingly towards outcomes that we did not intend. So that's why you're here, and I honor you for making the commitment, because I know you're an action taker if you're on this call. If you're watching this webinar right now, you care a lot about your health and your family's health, because you're not going to allow the outside circumstances get in your way to making the best choices possible for you and your family. So those allopathic options, let's take a look at this as we unpack it just a little bit more. Heat is pro-inflammatory. So you don't want to put heat on an inflamed joint. That's a recipe for disaster. Heat is a muscle relaxer, but if you put it on a joint that's swollen, it's going to make it worse. And then with bed rest, you're going to atrophy the muscles, and you're going to lose what's called imbibition. Imbibition is the normal movement of the spine that helps provide the healthy nutrients to the disc and the proper blood flow. What else is out there? You have the drugs. We talked about, is it safe? Is it effective? And what are my health outcomes? What's the risk behind it? And we see there's a lot of risk that is carried with those drugs. Physical therapy is fantastic. You know, it's excellent for treating the soft tissues around the problem, but we must address the underlying root problem first. And then you have steroid injections. It's a very powerful anti-inflammatory. It may help knock down the pain, but unfortunately on the backside of it, it can cause more joint deterioration. Surgery, you know, what are the risks associated with surgery? You know, that's the deal that you have to weigh the pros and the cons. Because you see that when you talk on the doctor's side of things and you say, was the surgery successful? The doctor outcomes with surgery, they're going to say it's like 95% a successful surgery, successful in their mind. But the truth is, when it comes to the patient, and when they survey the patient and successful outcomes with the patient in the surgery, it's like 10 to 20% at best. So there's a big gap between the doctor saying it was a successful surgery to then the patient outcomes and saying it's a successful surgery. So, you know, there's lots of radical procedures out there. And for me, it's about safety, it's about efficacy. Only as a last resort, these options would ever be considered. that we would be thinking about a more conservative, more natural approach, such as chiropractic. So as we talk about this and as we're going in this conversation, that when we're in pain, our body is not functioning at 100%. It compromises our immune system. Now more than ever, we need to make sure that everything that we're doing in our body strengthens our body and supports the immune system. So when it comes to making your choices to health, I know you have a lot of them out there. And so we want to be asking better questions. So I've included a list of questions to be asking the doctors when you are proposed a treatment option here. You know, what are the risks of the procedure? What are the costs involved? You know, just saying because my insurance pays for it, it's probably not the best decision maker right there, just that one decision alone. What are my expected outcomes? May I interview 10 of your patients? What does the research say? What are my options? Is this treating my symptoms or correcting the cause? I think to have successful outcomes in any individual that we work with, it's about setting clear expectations and knowing what the expectations are both ways. What are the goals? What's the objective? What are we trying to accomplish here? Now we take a look at pain sufferers and how they rated the treatments. You take a look at prescription medications and chiropractic treatment, physical therapy. You know, chiropractic is a much safer and less expensive route to go to in this when we're working on helping the body feel better and getting the pressure off of those nerves. Again, these symptoms in the body are what's called a body signal. As we said, your body's smart, your body's intelligent. It gives these pain signals because there's an underlying root problem. And if we just mask the pain, it's no different than when there's a fire in your house and the smoke detector is going off. Just going up to the smoke detector and taking out the battery. It doesn't make sense. The fire is still there. So what we need to do is explore the root of the problem here. And there are things that your body's trying to communicate to you with the pain to say, I need you to stop doing this, and I want you to start doing this. Remember what PAIN stands for? If you remember what the acronym of PAIN stands for, type it up in the chat box right there. Because sometimes pain is going to whisper. Pain will whisper signs. But if we ignore those whispers, then all of a sudden the body's going to scream at us. Did anybody figure out what PAIN stands for? Pay attention inside now. Pay attention inside now. That's what PAIN stands for. So when you have a body signal, the body signal is really the tip of the iceberg. When we do our thorough evaluation in the office, what we're doing is unearthing the underlying root cause. And in order to change the root, in order to change the fruit, the outcome, we need to change the root. We got to figure out what the root cause is right here. Because how you look at your health and what you believe about your health is going to drive your health outcomes. If your definition of health is all based on if you feel good, you're going to have different behaviors than if somebody says, my health outcomes are based on how well my body is functioning. So this is one of my favorite charts. I know Dr. Travis loves this chart. He's always having conversations about this with his patients. I'm having it too with you at this moment. I want you to take a look at this. At this continuum, you have high-level wellness. I want you to think of that as a +10. And then you have premature death on the far other side. That's a -10, and then the neutral point is a 0. At this moment, I want you to just pause in the busyness of life and just take a moment and just mentally put yourself on this continuum. Where are you at on this continuum? -10 to +10. Then what I want you to be thinking about on this is then what direction are you moving in? Are you moving more towards high-level health and wellness? Or are you moving away from that and more towards premature death, like more towards disease, illness, and symptoms? The neutral point, quite frankly, is probably the most dangerous place to be. And the reason for that is that you're not feeling bad enough to do more for your health and wellness, but yet the symptoms have not gotten bad enough to make a change. So be very careful if you're in the center. If you take a look at this, and you're in the neutral point, you start moving away from health, you start to get signs of the body. The signs are the precursor of symptoms. For instance, a sign may be stiffness, a loss of range of motion in your back. You're not able to turn like you once were. You don't have any pain, but you don't have the range of motion. That's a sign of a problem. Left alone, over time, then what's going to happen is that sign is going to turn into symptom, and eventually you're going to get pain. It's no different than when you're driving. And all of a sudden you get a little bit too close to the curb and boom, you jar that tire and it throws the tire out of alignment. And you drive like another 3,000 miles on it. What's going to happen to the tire? You're exactly right. It's going to wear unevenly. It's going to wear down the performance, and it's going to affect the health and longevity of that tire. Your health is no different. So, and what speed are you moving at here? Are you moving more towards high-level health and wellness, or are you moving away from it? The wellness aspect is once we get the symptoms under control, to address and heal the soft tissues, help correct the underlying issue. Symptoms tell us what direction we're heading in. What's interesting here is that your nervous system, the difference between feeling and function is that less than 10% of your nerves are for pain. The other 90% are the nerves that go to your muscles that could result in spasms or tightness or weakness and fatigue. And then the other nerves go to the organs in the body. And so if you're having pain in the body, it's likely there's some sort of effect that it's having in an organ. You may not be able to feel that right away, but you might notice altered function right there. But very interesting is that pain is only 10% of the nerve. So you can have an underlying problem that's brewing and be building for a long time before it starts to show up. But it's really no different than if you were to go to visit your dentist, right? Why do you go to your dentist twice a year? Typically, you're going for a preventative checkup, right? It doesn't mean that you have tooth pain, but the dentist can identify if there's a problem in the tooth that's beginning before the pain shows up. Very similar when you come in and you have your health breakthrough experience here, and we do a full evaluation on your spine and your nervous system health. And we check your spine and nervous system in every single visit that you come in here. So what we want to do is get ahead of this, because your nervous system is crucial for your optimal health and wellness. Your skull is the suit of armor, and your spinal column is suit of armor for your brain and your spinal cord. That's what houses your nervous system. It protects the spine and nervous system. And then that the nervous system then exits in between each one of those individual bones of the spine, and it goes to every organ, tissue, and cell. It's kind of like a circuit breaker. If there's too much load or stress going into the body and the body can't keep up with it, it's like a circuit breaker gets tripped. And then all of a sudden, we get the pain signal, and then we start getting a pain in the butt, or we get a pain going down the leg. We're not able to sleep, not able to exercise. Our quality of life starts going down. Our job as the chiropractor is to find which breaker has been tripped. We call that in chiropractic a subluxation. That's a misaligned vertebrae. It has a negative impact on the flow of that communication throughout the body. So if this communication in your nervous system stays optimal, you can experience health and wellness. But if any of these bones get jarred out of alignment due to traumas, poor habits, stress, then it's going to start to affect the function of the body. And when the body's not functioning well, that moves us away from our optimal health and wellness. I think you guys get it, because what happens in a family communication when there's miscommunication? Anybody ever been there? When you're miscommunicating with anybody? Anybody had a subluxation in a spouse communication or a coworker? Oh, now we're really seeing the hands go up. My goodness, that happens, right? Okay, there may be a little pain involved. And then what we need to do is circle back around and correct that communication. So if you want a healthy body, the bottom line is that you're going to need a healthy nervous system. If you want to have a healthy nervous system, the bottom line is you need a healthy spine. And as a chiropractor, that's our main focus, to help you achieve high-level health and wellness. And just remember, it takes the weight of a dime, that's it, of nerve pressure right here. And you don't have to have any pain to reduce nerve flow by up to 60%. So I'm not cool with having only 40% function of my organs in the body. I want to be as close to 100% and keep it that way. Who's with me on that? Okay. So what happens is there's a big physiological response that happens when you have low back pain, sciatica. Your blood pressure goes up, your heart rate goes up. You have an adaptive physiology. Your muscle tone goes up, you get more tense, your digestive system goes up, reproduction and sex drive goes down, your decreased serotonin levels, so those happy chemicals, sleep chemicals in the brain, they go down. Increased sensory systems, you're going to be more alert, anxious, worried, more with pain sensors firing, fear and anxiety is going through the roof. Anybody experiencing this right now with COVID, just this stress response? This is the fight or flight adaptive physiology that can lead to poor health outcomes. This downregulates your immune system. This is going to make your immune system compromised. Your blood sugar level goes up. You're going to have higher blood sugar levels, which is going to lead to more inflammation. Your cholesterol levels go all right, and your clotting factors go up. If anybody's hearing me on this, this is a recipe of disaster for a heart attack or a stroke. And with stress, it's very common. Even around the holidays, they've done the research as holiday heart syndrome. And heart attacks go up in the month of December and January with increased stress. So this has an impact on how your lower back is functioning and how those nerves are functioning down the leg. So you've heard me say this before, but it's worth reviewing. Your body, healthy is normal, sick is abnormal. Your body is smart and it's intelligent. Your nervous system is the master system in the body. Your spine is your suit of armor. And here's the truth. Modern life, pre-COVID, was already unnaturally stressful. Hands up if you agree with that. Should be seeing like double hands up, maybe a foot or two in the air. But since COVID, this is like pouring gasoline on the fire. It's become more stressful. There's more unknowns. There's more uncertainty. And think about the stress that's causing in your life and the impact that it's having on your body and the function of your lower back and those nerves going down the leg. 3 sources of stress: thoughts, traumas, toxins. If we were to look just 3 months ago, are you under more stress today or more stress today? Think about if it was just a year ago, 5 years ago. Today in 2020, nobody could have predicted this. Nobody could have expected this. Okay? We are under more stress than ever before. And now we're wondering about what's next, what's on the horizon. Still a lot of uncertainty, a lot of fear, and a lot of unknowns out there. Be aware of how that stress is impacting your body and understand how making sure that your spine and nervous system are in proper alignment will help increase the capacity of your body to adapt to stress. And simply, that's the definition of wellness, right? Wellness, by definition, is the ability of our body to adapt readily and appropriately to stress. What are stressors? Macro traumas are the obvious, could be like a car accident, slip or fall, some sort of sports injury. But truthfully, what is sneaking under the radar, especially with the COVID stuff, are these micro traumas and being connected and addicted to this device right here called a cell phone. And that when we find ourselves sitting at our phone, our head down, staring at this, or just sitting and slouching in the chair for hours on end, this is causing a buildup of trauma to the spine and nervous system. That leads to those things when you go to put on a sock, you go and wake up out of bed, you go and pick a piece of paper up off of the ground, and then bam, low back issue happens. Sitting is the new smoking these days. Now look, there's a lot to unpack in this webinar. We're bringing this one to a fast and furious close right here. I know it's a ton of information, but ergonomics here is a standalone webinar. Be on the lookout over the next 2 to 3 weeks for that next webinar. We talk about proper ergonomics when you're standing, when you're sitting, and when you're laying down. Sitting is the new smoking. There are a lot of bad habits here that we all could be doing better at breaking. So what's a subluxation? It's the misaligned bone caused by the stress, caused by the thoughts, traumas, toxins in our life that causes stress under the nerve. And when our nervous system is compromised, our body is not going to work properly. And I'm not going to repeat this again, but the subluxation repeats the fight or flight stress response in the body and essentially causes our hormonal system, our nervous system, our immune system to work in a very chaotic fashion, as to which we think that we're in a very much a survival mode, so our body acts like that rather than a thrival mode. Wow, what a ton of information here. Just know, as we say, this is probably one of the most important slides we're going to review, is less than 10% of your nerve sense pain. But it's no different than we talked about tooth pain. It's no different than heart disease, because is chest pain, is heart pain an early or late sign of a problem? Tell me an early sign of cancer. Tell me an early sign of diabetes. Usually with these chronic conditions, there's been a buildup of an underlying problem that has happened over years before symptoms show up. Subluxation is no different. So if you are a current client, great job on taking care of your health and your spine and being very proactive on that. If any goals have popped up during this webinar that you would like to discuss with myself or Dr. Travis, please let us know on your next visit. If you have a family member who's watching this with you or was unable to attend, get them to watch it and then consider having them come in for their health breakthrough experience. And then lastly, is if you have a friend, if you have a neighbor, coworker, somebody who's suffering from low back pain, sciatica, numbness, tingling, before they try those dangerous drugs or go into risky surgery, have them consider having an evaluation, a health breakthrough experience here at our office. And during that time, we may be able to uncover and unpack and unearth the root problem. So for you, in order for you to get the best results, number one, keep your adjustments in rhythm. Whatever the recommended frequency that I am or Dr. Travis is recommending for you in your chiropractic care, make sure you keep that in rhythm. Each adjustment builds off the previous one and it allows us to do our best work. As we mentioned, the standalone webinar, Break Bad Habits, and I've already talked to Lynn about this and Dr. Travis, we're going to make sure that we put together some exercises for everybody who is attending here on what exercises we recommend to make yourself bulletproof your lower back, but make yourself very functional in your day-to-day living. Because doing exercise isn't just about strengthening the muscle, it's really about making your body more functional so you can do the things that you want to be doing on your terms. This will then create the do's and the don'ts, the stop doing, the slow down, and the start doing list right here. So I want to share this story with you. This gentleman, John, 55-year-old, married, father of 4, he's a busy man, he's a business owner. Came to me literally crawling into the office. Bad spot. He was referred in by one of our other all-star patients. And John wrote a testimonial. Just to kind of give you the sense of his situation, as he would come to the office, his wife would drive him in their minivan and he would be on his hands and knees, literally on his hands and knees, because that was the only comfortable position he could be in. As he pushed through the pain to get to the elevator, he would be on his hands and knees in the elevator. As he came into the office, it became very apparent that he could not stand for more than 3 seconds, literally 3 seconds, before we had to rush him to a table so he could lay down. As you can imagine, his first day and his first visit, we needed to modify some of our techniques, but we were able to do so. We found the root cause of his problem. John wrote a testimonial. I'd like to share this story because it's super powerful with you. It's a super powerful story, and it may resonate with you. And here's what he said. He said, Dr. Brandon got me back on my feet quite literally. In February of 2017, I slipped a disc in my lower back. It became so painful that I could not stand for more than a few seconds without the pain becoming unbearable. I had never experienced anything like that before or since. I wanted to avoid surgery, and my internist suggested I try a chiropractor. I asked around, and several friends recommended Dr. B. He and his staff were outstanding. Dr. B, he told me he could help me, and I needed to stick with it in order to see, well, feel results. My slip disc didn't go away overnight, and it didn't happen overnight, so I couldn't have expected to be fixed overnight. Dr. B worked with me, adjusting my back and using other in-office treatments, giving me stretches to do at home, and providing advice that slowly and surely eliminated my pain and quite literally gave me my life back. Today, I am pain-free and I'm symptom-free, and I started my chiropractic adventure with a healthy dose of skepticism, but today I have no doubt that Dr. B has made all the difference in my quality of life. Don't hesitate. Go see him today. You see, John, he's a busy man, 4 children, heavily involved in their sports. He's a business owner. He's leading a team. Schedule's super demanding. Hobbies, he loves to travel. He loves to go to concert venues, loves to stand on his feet, enjoy the music, loves to work out, loves to exercise. Do things like that. Do things with his kids. Go mountain bike, among that. He's now exercising. He's living his day-to-day on his terms. Literally got his life back. That's our purpose. That's our mission here. And in closing, it reminds me of this interesting and pretty neat tradition that I heard of, where this family would celebrate an individual family member's birthday with a big chocolate cake. And with that, whatever age the child was or the adult was turning, they would have those many birthday wishes they would get to have. So if somebody was turning 15 years old, they would get 15 birthday wishes, 20. So the dad of the family was turning 40. So he had 40 birthday wishes. He said, hey, this year we're going to tackle the triathlon. We're going to do this. This year, I'm taking everybody to Europe. Everybody is hooting. Everybody is hollering. Everybody's super excited and stoked. Everybody ate the cake, celebrated. What a year it was. Then next year came around. Dad turned 41. Everybody got together again. They had the cake, did the tradition. The time came for the birthday wish. 41, right? No. Basically, Dad took a sticky note out of his pocket and he said, this year, I have one wish. It's to get my health back. You see, the dad was diagnosed with cancer. And when you have your health, you have many wishes. When you don't have your health, you have one wish. I thank you very much for tuning into this webinar tonight. I want you to be thinking about what your health goals are. Think about where is the next step in your life and what else you can be doing to help support your health and your well-being, not just for yourself, but for your family and the other people you serve. If you are a guest on this webinar and you would like to come in for your health breakthrough experience, how do we know there's a problem? Simply, we do objective testing to figure out where the problem is. And then we sit down and we review what we found. Based on your goals, we give you our best set of recommendations. So if you've not been checked, if you have a family member who's not been checked, or you hear about a neighbor, a friend, a coworker who's talking about this pain in the butt, or they're looking for some solution and they haven't found it yet, my recommendation is that they reach out to our office and then get checked as soon as possible. Thank you so much for being on here. And just remember, for you and your family's health and wellness, we've got your back. Go make it a great day. Thanks for tuning in. I look forward to seeing you all in the office soon. Thank you very much.